Well, on this Pride Month, we are highlighting a local nonprofit that is helping the local LGBTQ community, and they've been doing it for a long time now.
The Cascade AIDS Project, also known as CAP, is the oldest and largest community-based provider for HIV and housing services in our area. Dr. Tyler Termeer is the CEO of CAP and Prism Health and joins us live to talk about their important mission. Good morning.
Good morning. Thanks so much for having me.
Yeah, thanks for joining us. Okay, so tell us a little bit about CAP for people who are unfamiliar.
Yeah, celebrating and recognizing over 35 years of service to Oregon and Southwest Washington, CAP remains a robust social service provider helping people who are living with HIV pick up the pieces of their life and live a long and happy and healthy life. And we also provide primary care and behavioral health services to the broader LGBTQ plus community through a federally qualified health center.
Okay, and then how did Prism Health get started?
Yeah, I moved to Portland 7 years ago to be the new CEO of CAP. And as a Black queer man myself, I have faced a lot of discrimination in my healthcare, very much like other LGBTQ folks in their lives. And I worked with an amazing team of individuals here at CAP to build a plan for our future that would address this need in our community, a space for safe, culturally affirming, non-judgmental healthcare for the LGBTQ plus community.
Yeah, I think there can be a lot of barriers to healthcare for different folks. What are some of the biggest challenges and issues that that people come to you for that they've struggled with in traditional healthcare settings?
Yeah, I think like any group of people, we want our medical providers to understand the unique health disparities that we may have as individuals. And over time, because of the discrimination and stigma against LGBTQ plus people, that hasn't always been prioritized or understood in healthcare. So we know, because we don't collect appropriate data, that LGBTQ plus folks have higher rates of certain types of cancer or certain likelihood to other health disparities. Prism creates a unique value that we provide healthcare that's designed for and by the community in a very safe and accessible way.
Okay, and you also provide outreach and education for services as well?
Yeah, we're here to make sure that people have access to low barrier HIV STI screening, that they're educated about HIV and about other healthcare options. And what's really amazing about our services is the majority of them are free. And or we refer you out to other services in the community. If you don't have access to healthcare or insurance, we can help you get connected to those things to ensure that you're going to live a healthy and thriving life, regardless of how you identify.
Yeah, I think this is a fantastic service. I mean, everyone should have access to compassionate care, and the fact that you can offer it for free is incredible. So how can people find you if they or someone they know could benefit from these services? Where can they go?
Yeah, I'd recommend folks going to capnw.org, so capnw.org, our website, to learn about CAP, about our history. We're right now in a very important moment in our history as we celebrate Pride Month this month. We also just recognized the 40th anniversary of the first reported case of HIV in our country over this past weekend. So it's a great time to learn about CAP, the services we offer, and how we can help you and those in your life that might be affected by HIV.
Yeah, and it seems like people are living so much longer now with HIV, which is a good step in the right direction.
Absolutely, it really is. Well, Dr. Termeer, thank you for all the work you're doing in the community with the Cascade AIDS Project and with Prism. Great to talk with you this morning, and happy Pride.
Happy Pride. Thanks so much.
Yeah, and to learn more about the services that CAP offers, we'll link to that website for you on coin.com.